Vera. Dr. Vera, you're up first, I think. So we're going to have that talk first. And then after this, we're going to have a recorded presentation from Derek Core, who's going to be talking about how to innovate and a message from an innovator to all innovators. So that will follow on after this. And then after that section, at 4:05, we're going to have the final panel where we're talking about going beyond implementation and the education and training aspects about artificial intelligence. I'll be chairing that along with Nicholas Fuggle and Alex Aubrey. And then we'll be wrapping up a bit later on. But now that you're all here, I will hand over. Vera, would you like to come on top? And over to you.
Thank you very much. Hello, everyone. I'm Vera Moiseva. I'm a scientific lead at ACORE. And to continue this important conversation about ethical AI, I will be talking about advancing ethical AI in healthcare with cryptographic data mesh. So we all recognize that we are living in the golden age of AI and witnessing its transformative impact across multiple industries, and healthcare is one of them. So with all these benefits comes challenges, and as CEO of Microsoft, Satya Nadella, said we need to simultaneously address the benefits and dampen the consequences. So let's dive into these challenges. So the problems we at ACORE see when it comes to using AI in healthcare is following. So context and scale. So often healthcare data resides on premise, and AI models run in the cloud. And scale is not free. So cost of AI at scale can be significant, and also there are some sustainability concerns. Black box models. Many AI models operate as a black boxes, so it's difficult to understand how decisions are made. And this raises concerns about bias, fairness, and data integrity. Compliance, so managing consent, privacy, intellectual property adds additional layer of complexity. And the last is controllability, so governance of AI models, data and compute resources are crucial. We think that ethical AI is a necessity, and here's how we can achieve it. So first, decentralized data. So instead of using centralized data hubs, we should connect validated systems and keep AI on premise, and cryptographically track changes. More efficient AI. So creating context-specific, verifiably trained multimodal AI model, and use it in a decentralized manner. We should be able to see that how these models evolve over time. Explainability. So we need to clearly understand and articulate how these models and AI and algorithms make decisions. So lineage tracking, so track AI models, human and AI interactions, and flagging all hallucinations and non-compliance is crucial. Decentralized governance. So instead of rely on one big tech firm, we should involve multiple stakeholders and in a transparent way. So this would create fairer ecosystem. So who is ACORE? Acor is a software company, and our team is creators of OpenCDC, Health Data Explorer, and cryptographically data mesh, and ethical AI technologies. And we've been in the open health space for a few years already. And our focus is on delivering user-friendly, interoperable, and ethical AI solutions. So these Acor solutions are based on three main components that provide foundation for computational trust. So it's Acor platform, Acor data mesh, and distributed applications. Acor platform is the basis of all our solutions. It helps to improve compliance and verifiability through decentralized technologies, and accelerate cryptographically enabled health data applications and ethical AI practices. Cryptographic data mesh designed for using decentralized data and cryptographically connect them without costly decentralization. So it's lowering the cost, basically. And distributed apps. There are some examples of our applications in healthcare: Health Data Explorer, Clinical Trials Explorer, and Organ Data. And they are all modern health data and ethical applications, and they help to improve lives. So I will demonstrate you one of our AI solutions, Cancer Trials AI Companion.
Introducing Acor's Cancer Trials AI Companion, an ethical AI-driven solution that empowers patients, researchers, and healthcare professionals with reliable and trustworthy insights. In this example, information regarding Hodgkin lymphoma is being requested. You'll quickly receive an accurate and detailed response. Every interaction is encrypted and securely stamped on Hedera Hashgraph Ledger. This ensures that each conversation thread is not only private, but also trustworthy. Hover over any source, and with one click, you're directed to the original data source for in-depth information. Continue the conversation effortlessly, ask follow-up questions, and the AI companion keeps track of context, ensuring consistent and personalized care. Transparency, ethics, and trust are at the core of our AI companion, especially given the sensitive nature of cancer trials information. Visit the Chat AI audit screen to see a complete history of stamped events. Select any event to review its content, including the user question and AI answer. You'll also see a stamped lineage timeline recording all events from inception all the way up to the most recent insight, offering proof of the event's ethical history. At Acor, your health connects with ethical AI. The Cancer Trials AI Companion is grounded in ethics, driven by trust, and committed to transparency. Learn more at acor.com.
So in conclusion, ethical AI is important for all responsible innovations in healthcare. And here you can see references for the technologies I mentioned and places where Acor were featured. So thank you very much. And visit our stand F9 if you have any questions. Happy to see you there. Thank you.
So, hello, my name is Fina Mateo, and it comes not as a surprise that I'm going to be talking about Legit Health, the other startup that is here present in the Startup Showcase. I want to do that briefly, because I believe there is something more important to talk about, that is AI, and how it's going to be shaping the future, in this case in dermatology. So, Legit Health has developed an AI medical device, actually certified. I like to say here before, I don't know if this morning you have been in one of the conferences. It's very famous here in the UK, Skin Analytics. But I'm sorry to say it's not the only CEA certified. Legit Health is also certified, and you will learn a little bit more over the slides. But as I said, I want to be briefly about that because I want to talk to you human to human. How am I going to do that? Yep. It's not working. The green one, right? Yeah. Didn't work. First of all, I want to talk about AI. I mean, it at least came as a surprise for me that AI is a technology that has been in the market already for almost 70 years. But I haven't heard about it until recently. I'm sure that many of you has been a little bit the same. And I think, correct me if I'm wrong, that might be related to the appearance of ChatGPT. ChatGPT has made it available for the public, has made it known by everybody. And then it was easier for those solutions already in the market that were fighting to get this technology inside healthcare to be able to penetrate the market and say, hey, we created a tool for you, and it's here for you to use it. But what came along with that? And here's the human part that I was mentioning before. We are already familiar with some of the things that AI can do for us. It can do paperwork. We all like that. Who likes to do paperwork? No one. If AI can do that for you, we are going to like it. It can also analyze. It can also show you reports, saving you time. We also like that. But then we get into a little bit of a gray area. Diagnosing, and we already know, it is already well spread, the diagnosis of suspicion of malignancy. So all those skin pathologies that are malignant can be helped to be diagnosed with AI. We already know that, and there is where it gets tricky, because is this going to replace our job? This is one of the main questions I've heard in many, many different conferences I've gone through. Well, the answer, we already know it. No, it's a tool. It's a medical device to be used by professionals. So, okay, this is what we know so far, right? Let's go and take one step more. This is what Legit Health is. So what we have done is that we have developed this AI to help in the diagnosis of more than 300 pathologies. And I placed this GIF here so you can imagine a little bit how the AI works. And this is what it looks like and what it sees. So the AI analyzes pixel by pixel the images and looks at what, in this case, a dermatologist, so the specialist would be looking at. For what? To assess severity. So before, this was done with pen and paper. A little bit later, that was kind of made simpler by making it digital. So you didn't need to write and calculate by yourself. Now what we have done is just with one picture, we have integrated some of the most commonly used scoring systems, and we have automated so you can get the result of the severity of pathologies like, for example, psoriasis or hidradenitis suppurativa or even alopecia, which is not a skin pathology but also visible on the skin, just in a couple of seconds. What does that allow us? Well, there is this challenge that you all have heard, the bottleneck that is created with the shortage of specialists. How can we help to that? With a smart referral. If you empower GPs to have these tools, you are giving them knowledge that is available inside that AI that is going to help them to refer at the time that is needed. And also when it's needed, and prioritize those cases that really need it. So obviously, there we go. Malignancy is going to be the top of the list, but there are also chronic diseases that patients suffer from, and that we shouldn't be discharging these patients just because we need to prioritize malignancy, but just give them the proper spot on the list. What else can we do with it? Well, as I said, we automated the measure of severity. That also means that with pictures over time, we can measure the evolution automatically, and also help, in this case, the specialists to improve the treatment outcomes. Nonetheless, it all will depend the healthcare provider how it will bring them the most value. There are healthcare providers that will use it by empowering dermatologists. There are others that will use it, empower even nurses or GPs to help to agilize the flow. This is the result of one of the studies that we did during our validation in 2021. So we proved that we could agilize the visits of patients, of course, with a TLE dermatology, from presential visits of up to 8 visits per hour to 52. That's increasing a lot the kind of help that the doctor can give. But of course, for what do we do this? Again, the human factor, the patients. This is also a result from one of the studies that we conducted in 2021, where we asked the patients what they found of the technology. Here is some of the data. I wanted to approach this talk, as I said, from a human point of view, but I'm sure that many of you also want to know a little bit more. And I'm happy to tell you that there is much more data available. We have released peer-reviewed papers, scientific papers that you can also look at, and you can ask us more questions, also how our AI is built, and more technical questions that you might be wondering. But before, I want you to ask yourself, in this case, obviously, it's going to be about Legit Health AI, but what can AI do for you? For everything else, all the questions, you can find us in the stand CO, and our colleagues, Jorge and Patu, will be helping you in what you need, and also referring to you to all this technical data that I'm sure that you're also interested in knowing. Thank you.